and that is autism, where the right brain is delayed in its development because these reflexes aren't going away and other factors. That left brain comes online too early because they're naturally gifted, and now it dominates over the right. And now that is a bad situation. And that gets worse as time goes on. And we literally have kids that are non-speaking that can type on letterboards and tell us that there's this raging battle between the left and the right brain, where the left brain doesn't want to give up its dominance because it's essentially a control freak.
Yeah, we'll eventually have to bring the conversation to like some of the things that you guys are doing in clinic to change that. Rob,
Steve, can I jump in one moment?
Yeah, absolutely. And then I have a
Piggyback.
question for you.
So back to something we said earlier, but also Dr. Miller just brought it up. And again, you guys were alluding to like kind of when is that breaking point, right? And how do we see that breaking point in this asymmetrical distribution? I think this is one of the things that we see in the diagnostic continuum that we often see with the children that present to our office, okay, where, let's say a 10-year-old child or a 12-year-old child presents to either one of our practices, and you do the history workup on them. And the parent may easily say, yeah, my child was very verbal early on in development, okay, around that 2.5-year-old, 3-year-old mark, and developed almost like a professor syndrome type of thing. The kids had this very high vocabulary. And then when they go into elementary, they go to preschool or pre-K or kindergarten, they do okay, but they're initially maybe being described as inattentive or maybe more so hyperactive or impulsive, okay, or they may even show some signs of STEM behavior where obviously they have these very repetitive behaviors that they're doing, maybe with their hands or their body, or maybe even verbal stems, or something like that. And usually what happens is that, as Dr. Miller alluded to, the idea that the two sides of the brain are going through these developmental shifts, okay? And that when that left brain that or shouldn't really have turned on to maybe about 2.5, going into like that 3 to 6 year window, okay? Because the first 3 years is the right, but usually around that 4, 5, and 6-year-old level, if the left hemisphere already was developing too rapidly in those first 3 years, we get a major bump then, okay? As they're beginning to enter like maybe first grade, or transitioning, maybe now getting up a little bit higher in the second grade. So this is usually what we see diagnostically, where all of a sudden it went from, like, let's say maybe like an ADHD diagnosis to now they go to their pediatrician, and the pediatrician is saying, well, not only does your child have ADHD, but your child has like a motor tics, okay, or maybe even showing some Tourette-like symptoms, or worse, maybe even showing some obsessive compulsive types